everyone. My name is Dr. Chaudry. I am a primary care physician and clinical director of North CLACTON Medical Group. In my last video, we discussed symptoms, causes, and some prevention techniques for deep vein thrombosis, also known as DVT. Today, we are going to discuss and elaborate on management and treatments of deep vein thrombosis. Some simple measures such as elevation of legs, especially designed stockings to reduce swelling, and painkillers to manage pain may be suggested by your clinician. The specific treatment of DVT, however, is usually the use of blood thinning medication known as anticoagulants. The treatment is aimed to prevent further clot formation and to inhibit the existing clot from getting larger or part of it being dislodged from its site and reaching other parts of the body, especially the lungs. It also helps in the prevention of long-term complications from DVT, such as persistent pain and swelling due to chronic insufficiency of the veins. Blood thinners do not break down the clot, which can be dissolved over time by the body's own defense mechanism. Anticoagulants may either be given by injection or by mouth. Once diagnosis of DVT is made in the community, a blood test to assess the functionality of other body organs is sent to the laboratory. The primary care clinician usually then administers an injectable form of anticoagulant called low molecular weight heparin, or in short LMW heparin. This injection is given under the skin. The patient is then referred to the specialized DVT clinic for further assessment and long-term treatment planning. In certain circumstances, and depending on the suitability of the patient, instead of injections under the skin, a newer form of oral anticoagulant tablets known as novel oral anticoagulants, or in short NOACs, are started. These newer forms of drugs have the advantage of being continued for the full length of treatment as decided by the physicians without requiring further dose adjustment. On establishing the site and size of clots by scanning, long-term treatment of DVT can be planned. It is discussed and agreed between the patients and physicians. There are several regimes and local protocols that may be suggested by your physician. An old and well-trialed blood thinner pill called warfarin may be started orally in conjunction with low molecular weight heparin injections, which are given under the skin, usually for 5 days, to be continued together. This is to establish that blood thinning effect of warfarin is effective. Warfarin pills can then be continued for 3 to 6 months as per local protocols. Once started on warfarin, regular blood tests are required to ensure that right dosage of warfarin can be suggested, as too little will not prevent clots and too much may risk dangerous bleeding. However, if bleeding occurs, the blood thinning effect of warfarin can be reversed by drugs such as vitamin K, but they should be under the medical supervision. If suitable, the newer type of blood thinner NOACs can be suggested by the clinician. In that case, the initial course of low molecular weight heparin injections may be continued for a slightly longer period. NOACs works as effectively as warfarin but may not be suitable for all patients. The advantage of NOACs is that no dose adjustment is required, but the exact timing of taking the drug is to be observed. Some general blood tests may also be required at certain times. If the clot is too big or has the potential to cause serious complications, the hospital physicians may use other types of drugs to dissolve the clot, which need to be done under specialist care. Rarely, direct surgical interventions are also required to dislodge or dissolve the clots and prevent it moving from other parts of the body. In pregnant women, DVT is treated by low molecular weight heparin unless it is contraindicated. In that case, NOACs are preferred and use of warfarin is avoided due to potential adverse effects of warfarin. The injections are commenced immediately until DVT has been excluded. The low molecular weight heparin may be given through the remaining time of pregnancy, and women are trained to self-administer their injections under the skin. Strict time regimes have to be observed. Women are advised to stop self-administering low molecular weight heparin as soon as they feel the labor has started. During labor, clinicians may decide to administer another form of heparin given through the veins, which can be controlled better to avoid excessive bleeding during surgical or natural birth process. The anticoagulant therapy has to be continued in the postnatal period for a minimum of 6 weeks or to complete at least 3 months of total treatment. So to conclude, the treatment of DVT is with anticoagulants. There are different forms of anticoagulants available. The treatment has to be started by your doctor, and you should observe the instructions from your doctors and observe the follow-up protocols. Prevention is better than treatment, and prevention is to stay active and stay safe.